graduated from here in 2007, I believe. Since then, I've decided to go back to school. I finished my bachelor's at Northwestern in 2012, and now I'm set to graduate with my master's in December. So, exciting times. And I know you were sitting there today, since it's your last day, and y'all were thinking, no, I'm not going to go back to any more school. But trust me, you're going to get out, and you're going to want to go back later. I said the same thing. I was like, no. A couple years, you'll be ready to go. These ladies and I, our topic under discussion we decided to talk about was cell phones. I mean, everybody has their cell phone on them all the time, right? So what we were wondering was, does the use of cell phones impact our physical activity? Mm-hmm. So what do you guys think? Yes or no?
Yes.
Yes? Okay. That's kind of what we thought. I'm wondering though, do you think it impacts it negatively or positively?
Negatively.
That was our hypothesis, exactly. We were like, oh yeah, it's going to decrease physical activity. So what we did, we came up with a survey, and we'll show you all that in just a few minutes. And it was an anonymous survey. And to make it kind of easier on us, we kind of passed it out at work, and each one of us did like 25. And they were, we took that as their consent when they signed it to do the survey. But we were a little surprised by some of our results. These ladies are going to tell y'all more about it. But how many of you use FitnessPal?
Me.
Most of you? Yeah. Okay. All right. And how many of you use Facebook? Or social media, at some time. Okay. Well, just to be thinking about that, and I'm going to let them explain to you what our results were. Okay? Thank y'all, Kira.
All right. Well, kind of introduced myself earlier. My name is Melinda Mello-Hargrove. Been married, got married a few years back. I started off late in school, getting my associates in nursing when I was 30. Then I thought to myself, well, you know what? I don't like dealing with patients. I'm going to go to the business side. I'm going to get myself a degree in healthcare management. Did that, and it was worse dealing with the nurses and babysitting them. So I went back and got my bachelor's. And now I will graduate April 11th of this year with my master's in nurse practitioner. So, like Karen was saying, we all thought when we had to start this that cell phones are going to affect our lives negatively. We see people sitting down all the time. We see them texting, Facebooking, playing games. My husband's bad for it. He was sitting there for hours just playing games. So we presented this question to a lot of nursing faculty, healthcare faculty. And this is a lot of the results that we got. I know this is small and I apologize, but basically we had 68 females and 32 males in our survey, and their mean age was, well, it wasn't their mean age, but their age was between 25 and 54. That was the average ages. We had some younger, we had some older. We had asked them what their education level was. All of them had their high school diploma, excuse me, and 59% of them had some sort of college degree. We asked if they used their cell phones for anything other than just making calls. 100% of them did that. And we also asked how many of them used their handheld devices for physical apps, and 7% acknowledged that. We asked how many used social media on their phone. 54% admitted using it for less than an hour, 37% for an hour to 4 hours a day, and we had 9% admit that they use it more than 5 hours a day. We also asked how much physical exercise do you get in a day. 67% said they do at least 30%, or not at all. 17% said they work out an hour a day, and 16% said they work out more than an hour a day. And as far as the impact on physical activity, 9% said cell phones increase their physical activity. They use it either when they listen to music or use an app on the cell phone. 29% said that it decreases their physical activity because they're sitting there using their cell phones. And 62% said it had no impact. We really thought that would be reversed. We really thought that the individuals that said it impacted their lifestyle negatively would have been a lot higher as far as not getting up and moving around. And we had some limitations on this research paper that we did. Some of our answers did not give them options to say, I did no physical activity. Some of the options, we also said that we didn't give them the option to say that they don't use the cell phone at all for any social activity. The study was flawed mostly because of that, and our interpretations proved that if the phones are used for physical activity, it actually increases their physical activity. What I'm trying to say is, if people use the apps on the phones, it increases their physical activity. So we could not prove our hypothesis. Our hypothesis was not, the data was not significant enough to prove our hypothesis. So we had to go on and try to suggest ways that we could alter the study in order to get, and we don't want to use the word accurate because our data was accurate, it just did not prove our hypothesis. So we suggested that perhaps we reword some of the questions, we educate some of the volunteers on how to use apps for physical fitness, and we also suggested that we offer a more variety of answers to, so they could be more specific on their answers and be able to say, no, we don't exercise at all, or no, we don't use our cell phones for that at all.
Good job.
Okay, just to elaborate a little bit on what Melinda was just saying. I'm sorry, I'm StaCee LaCour. I know I had said it earlier, but sorry to reintroduce myself real quick. But another limitation that we had on our study was also the small sample size. We only had 100 participants, and they all came from a healthcare facility. So we didn't really go out into the community and do more of a generalized study. So that was a limitation as well. And in addition to some of the suggestions she made about future research, we were also saying that prior to initiating the surveys in the future, if someone chose to choose a study similar to this one, we can maybe interview the participants prior to beginning the survey or experimentation to see their knowledge level, to see if they truly understand the questions that were presented in the survey, and also to see their expertise level on using handheld devices. They may not have realized that reading the book on, Kindle on your phone or playing games or solitaire, anything like that, they may not really truly understand that that's considered using screen time on these devices that could possibly, decrease physical activity, or in some cases, like we said, our results showed it actually increased physical activity for some of our participants.
Good morning. I'm Jessica Ravare, and I'm also a graduate of LSUA, but that's been since 1984. So I'm the granny of the class, and I just kind of stair-stepped my way through. And when I left LSUA in 1984, I said I would never go to school again. And when I would pass by Alexandria going that way, I would kind of look this way. But needless to say, I love being a nurse, and I have to say, but it was hard, but nothing worth having come easy. So I will tell you the same thing like Karen, I have to agree with you that later on when you're going to see, I have something else I want to do, then do it. So I had the pleasure of attending NSU to get my bachelor's with Ms. Bordlon here. So there again, that came 20 years later though. Was my daughter leaving off to go to school, UL, and I said, okay, I'm going to go to school too. I have not the empty nest syndrome, but smaller nest. So needless to say, I wish, best to all of you, and I hope you have a long and prosperous nursing career. So needless to say, I did mine since I was 19. I started out, and, here I am still going. But I took baby steps, and I have no regrets. So there again, kudos to all of you. Okay, to conclude our study, we have to say that naturally we live in an era where handheld devices, they're our future. Okay, can we live without it? No, kind of like when I walk out, I'm feeling for it and stuff like that. And I said, well, I didn't understand why the youth and the younger ones, they always had phones and stuff, but they playing games and those kind of things. But we can say that the study showed us that there are so many usages, for the devices. Sure, some people use it for entertainment, nothing wrong with that. Some people use it for fitness, which is very good, and as healthcare providers, that's a positive thing for us. So there again, if you're going to use it as that, then naturally you're going to have outcomes that's going to be positive. But there again, when we went into it, we were there saying, oh, our kids, and like even my grandkids, they got their first like she said, iPod, couldn't even talk about it, she was 1, you know, and she's there playing like that, and I'm trying to get my computer, and she's turning it on before I can. But you know, I didn't grow up in an era where I had computer, so that there again is the thing of the future. So it's all in what we're going to do with those devices. So there again, will it impact wellness? Will it impact health? So therefore, again, the study, you know, here as Melinda was saying, you would have to say, well, until we get to that point, we would have to probably have another study done with the things like StaCee was saying here, that would help us have a broader knowledge of what we're doing. So there again, we can say that handheld devices can, and negatively and positively, impact us. But our study, the hypothesis, was just kind of opposite of what we were thinking. But was it incorrect? No, the data was not incorrect. We got the population, you know, as Karen stated also, we got the group of people, wide range of people in healthcare, 4 different people, and those are the results that we did have. So there again, we can say that the questionnaires, StaCee did say it too. It would have to be tweaked to get more in-depth results, but there again, we did have a start, and we do see the impact of what it's actually doing in our communities. And it was trended to Central Louisiana. The 4 of us do live in Central Louisiana, and that's what we were gearing towards, what was going on in Central Louisiana. So do I have any questions about possibly what we presented to you today about handheld devices and what's your feel of what it's doing in our communities?
And please feel free to look at our poster if you want to after we finish, or if you want to get up now so you can see and access some questions, we'll be more than happy to answer.
Anybody?
They're ready to go home.
Well, I just want to say
Congratulations,
thank
everybody.
you.
Good